Diabetes remains a common non-communicable disease affecting both children and adults. While there are different types of oral medication that is used in the management of diabetes, some people, and especially children, need insulin.
The cost of insulin, some places is highly subsidized, where you can get it for even 500 shillings. Some other places, when it is not subsidized, around 2,000, 3,000. Insulin also depends on the dose. There are people who are using what we say like 30 units of insulin per day, and there's some people who are on very high doses of insulin, maybe even 60, 70, 80, 90 units per day. So the cost, again, if you're doing 30 units, your cost may be 1,500. But if you're going to do 90, then you have to multiply that by 3 to around 4,500. And mind you, when you're on insulin, you need to do more regular checkup of your blood sugar, even from home, because it can go low, it can go high.
This requires one to have a glucometer that will use strips to monitor the sugars. This comes at another cost. What happens when one develops diabetes-related complications like kidney failure?
By the time you're having complications of renal failure, invariably you'll have complications of the heart and probably the eye. If you're talking about a patient who has end-stage renal disease, they're on dialysis minimum twice weekly. We are very fortunate that currently the NHIF is able to cater for at least the dialysis. But when you're undergoing dialysis, there are other things that you need to buy. Your blood level is likely to be low, so you're likely to be on medicine to boost your blood. Occasionally, you may need to be admitted to be transfused, and the other complication that may arise out of that. So in terms of quantifying that, the cost is very variable, depending on the level, and again, how often do you get these complications that arise.
All these being the direct costs. Other costs like transport to the hospital, diet, or days missed from work make diabetes a costly affair.
The other complications that may arise, let's say people undergo amputation, that's a form of disability. Some people develop blindness or even reduced vision. So that means that that's another complication. If you need to rectify the vision, again, that's a cost. If you start getting heart failure, the treatment is enormous, because you know that diabetes is actually a very big risk factor for what we call coronary heart disease.
All these costs are heavy, especially for those struggling every day to make ends meet.
When you talk about someone spending 1,500 per month or 2,000 per month, if you divide that by 30, it's around 50 shillings per day. And we know that half our population are actually living under less than $1 per day. So if 50 shillings per day may appear a small amount, but that's actually 50% of that person's earnings per day.
It may not be all gloom and doom for people living with diabetes, especially if the plan for universal health coverage in Kenya actually leaves no one behind, particularly people with chronic illnesses.
The NHIF is able to cover, mostly in the mission centers and public sector, it's able to cover, because the cost of medicine there might even be, as you said, 500, 700. But even that, it does not cover most of it. It probably covers consultation because they have a cap.
This plan should not only provide the financial cushion, but also provide quality care through qualified and dedicated personnel for diabetics. Dr. Mercy Korir for your health budget, KTN News.